Welcome to the presentation on Marfan Syndrome for Lifespan 3. In this presentation, we will address several factors of Marfan Syndrome, including the pathophysiology, presentation and clinical manifestations, the course and expected outcome of the disease, what you would teach a patient diagnosed with Marfan Syndrome, treatment options available, and an example of a nursing diagnosis. Marfan syndrome is an autosomal dominant trait that affects the body's connective tissue. As an autosomal dominant trait, a person with this diagnosis has a 50% chance of passing the mutated gene onto their offspring. It occurs in 1 in every 5,000 births. 75% of these come from a parent who has Marfan syndrome. 25% occur through spontaneous mutation, meaning that there is no explanation for it. The mutated gene that causes the disease can be found in chromosome 15. The mutation causes an increased production of a protein called transformation growth factor beta. This protein most commonly affects the connective tissue in the bone and joints of the upper and lower extremities and the thoracic cage, the cardiovascular system, most commonly the aorta and heart valves, and the connective fibers that hold the optic lens of the eyes in place. The physical appearance of a person with Marfan syndrome may appear to have a very tall and slender build with very long upper and lower extremities. Their joints may be abnormally flexible, their chest may curve inward or outward, or scoliosis, which is an abnormal curvature of the spine, may be present. There are also non-visible effects of Marfan syndrome. Due to the increased protein in the connective fibers of the eye, this person may present with nearsightedness, meaning you can easily see objects up close but not far away. Astigmatism, which is an imperfection of the curvature of the eye that affects sight. Ectopia lentis, which affects more than half of people with Marfan syndrome. This occurs when the lens of the eye, which directs light rays into the retina, becomes dislodged, resulting in worsening of visual acuity. Other risks for the eyes include early onset cataracts, retinal detachment, and glaucoma. The effects of the heart often include a weakened or dilated aorta, which places the person at an increased risk of aortic dissection, leading to internal bleeding. Marfan syndrome is a lifelong congenital disease with no cure. Due to the physical symptoms becoming more apparent with growth, a child with Marfan syndrome may not be diagnosed until age 3. Every person born with Marfan syndrome will have the same defective gene found in chromosome 15, but not all symptoms will present the same. Some people are minimally affected, while some people have symptoms that are life-threatening. As you grow in age, progression will worsen. For someone with Marfan syndrome, pregnancy brings increased risk due to an increased cardiac volume and pressure on the aorta. Recent studies have shown that there's a significant increase in age expectancy for someone with Marfan syndrome. Previously, a person with this diagnosis was expected to die in their 40s. The current life expectancy for someone with this disease is somewhere in their 70s. One important thing to note is that although the person's physical appearance does not look normal, their level of intelligence is not affected. As a nurse, you may teach a patient with this diagnosis that limiting physical activity will relieve strain on the cardiovascular system. A child with Marfan syndrome should not play any kind of sports that can cause trauma to the chest or cause excessive stress on the heart. Some examples would be running, weightlifting, basketball, baseball, football, gymnastics, or track. Instead, focus them on sports such as swimming, walking, or dancing to minimize strain on the body and heart. If you smoke, you are putting yourself at an increased risk of cardiovascular concerns. You'll want to emphasize the importance of maintaining your health by regular doctor visits for your bone and joint health, heart health, and visual health. Finally, genetic counseling is suggested for couples who are considering having children so that they understand the probability of passing on the gene. Some treatment options for a person with Marfan syndrome may include pharmacologic treatment of beta blockers to prevent aortic dilation and pain management. If scoliosis is present, a back brace may be ordered for correction or stabilization. In cases where there is a risk of aortic dissection due to aortic dilation, or if heart valves are affected, there are surgical options including an aortic graft, which is a man-made tube that replaces the defective aorta. For those who need heart valves replaced with a composite valve, the patient will be put on blood-thinning medication to prevent blood clots. An example of a possible nursing diagnosis for a patient with Marfan syndrome may be decreased cardiac output related to the dilation of the aortic root as manifested by hypotension, edema, dyspnea, and low oxygen saturation. Interventions would focus on monitoring and reporting the presence and degree of the following symptoms: dyspnea at rest, orthopnea, which is a shortness of breath when the person is lying flat, paroxysmal nocturnal dyspnea, which is attacks of severe shortness of breath and coughing that usually occur at night. It may awaken the person from sleep and it can be frightening. And also lightheadedness when you change positions, and this is due to hypotension. Here's our first NCLEX style question. What is the biggest threat of Marfan syndrome? Is it A, retinal detachment, B, aortic damage, C, negative self-image, or D, joint pain? The correct answer would be B, aortic damage. This is the correct answer because aortic damage places the patient at an increased risk of aortic dissection, which could lead to internal bleeding. Risk of bleeding is a bigger threat to the person than retinal detachment, negative self-image, and joint pain. And our second NCLEX style question is, a person with Marfan syndrome commonly presents with which of the following clinical manifestations? Select all that apply. A, intellectual disability, B, hypotension, C, farsightedness, D, long extremities, and E, scoliosis. And the correct answers are B, hypotension, D, long extremities, and E, scoliosis. These are all true manifestations of Marfan syndrome. You would not choose A because intellectual function is not affected. And you would also not choose C because a person who has Marfan syndrome commonly has nearsightedness and not farsightedness. The last two slides are the references used to gather information. And we hope you enjoyed this video about Marfan syndrome.